Hi there. Do you have small children between the age group of 6 months to 5 years at home? Do you have children who are falling sick often? Or do you have children whom you're taking to the hospital frequently? Or do you have children who need some sort of medical or professional help for their physical growth and you think infections are causing a delay in their physical growth? In such case, this discussion is for you because I'm going to give you some tips how these problems can be resolved while you're sitting at home.
Environ Life Science Limited, partnering for life.
My name is Dr. Nitesh Agarwal. I'm practicing as a pediatrician and newborn specialist at Southern Gem Hospitals in Hyderabad. My background is that I studied my MBBS and MD pediatrics in India and I studied my neonatology in Australia. So I have now been practicing for almost 19 years. So what is fever? Actually, whenever we record the body temperature and if it is more than say 98.6, it is considered as fever. Now, so many times what happens, this may be because of simply not having had enough fluid, so we are dehydrated. Dehydration always leads our temperature to be elevated, but there are many disease conditions wherein the body temperature will be elevated. It is just a response of a body to, say for example, an infection, a bacteria or a virus being in the body. So just like if there is a water and you boil it so that if there are any pathogens or disease causing microorganisms in the water and by boiling you are killing them, therefore making the water pure. Similarly, our body tries to kill the organisms that may be in our body by increasing our body temperature. However, as medical professionals, as parents, as general public, we take it as an indication that there is some sort of an infection or some sort of a disease that is happening in a child's or an adult's body. And then, of course, we seek help. That is from a medical professional help. Now, fever could be caused because of infections and also non-infectious causes as well. Infections primarily come from bacteria, viruses, fungi, and other amoebic and parasitic microorganisms. Non-infectious conditions can be things like what we see in connective tissue disorders, soft tissue disorders. Nowadays, we are seeing a lot of children with conditions such as MISC, wherein there has been an infection in the past and now there is an immune response, therefore the child is becoming sick, there is fever as well. So this can be secondary to infection or a non-infectious reason. Important is to identify what is the cause and treat accordingly. Now sometimes if it is a bacterial infection, although this is not the commonest source, so I would rather start off saying, say it is a viral infection, which are the commonest cause for infections. Now there is not a lot of treatment that is needed. What is needed is good hydration and good supportive care. We don't need antibiotics for viral infection. When it comes to bacterial infections, firstly we should always prove, as medical practitioners, we always aim to prove or identify the source of infection. Where is the infection coming from? If possible, to identify the organism or the bacteria that is causing the infection and treat accordingly. So in proven bacterial infections, definitely we would have to give antibiotics depending on the place where the infection is, whether it is acute infection, a superficial infection wherein we can treat with short course of antibiotics. But if it is a deep-seated infection, for example in the bones or in the brain or in the bone marrow, in such cases we need to give long-term treatment, or in the heart for that matter, then the treatment is a little bit prolonged, maybe ranging between 4 weeks to 12 weeks as well. So that is very important. Now secondly, one more thing we should focus on is if say for example we have been giving antibiotics for a prolonged period of time. Now that kills off the healthy bacteria as well in the body. That gives an opportunity for what we call opportunistic infections. Most of the fungi are opportunistic infections. In today's world, we all hear about the eye infections post-COVID treatment. Now that is an opportunistic infection. The fungi which is present in the air, in the wall, in the water, Once the antibiotics and other things are given, steroids are given, the immunity of the body goes down, and these microorganisms, the fungi, they kind of superinfect the body, especially superficial organs such as the eyes, and then that infection could go on to lead to brain infections as well, up to as much as meningitis. So these kind of things are extremely important for us to understand. Now, so many times, as I was telling earlier on, if in case it is a post-infectious or a post-immune response fever, where we consider it as a infection, there the focus should not be on antibiotic treatment, but on identifying the cause for the fever and then treating accordingly. For example, in autoimmune disorders, there our own body is acting against our own tissue. So the immune system is overactive. So we need to suppress the activity of our immune system, thereby reducing the fever. So these are some broad speaking reasons why fever happens and how it can be countered, where we need antibiotics and where we do not need antibiotics. So when it comes to infections in the very young, we all realize that breastfed babies do not fall sick for as long as they have been exclusively breastfed. And the reason for that is breast milk has a lot of anti-infective properties in them. So when we hear about babies who are on formula milk, say for example in the first month, second month, third month, they tend to fall sick more often. So that is exposure to external milk, and it's not just the milk alone. The delivery system, whether it is being given by a bottle, whether the bottle is sterilized or not, whether the milk prepared is with the use of sterilized water or not, whether the artificial nipple is being cleaned, sterilized or not. These are the common reasons. If they are not, then obviously the infection risk will be very high in these very young children who are even less than 6 months old. Even in children who are 6 months and above, they become explorative. So they're starting to move around their hands and legs. They're touching all the surfaces. As they come to 9 to 10 months, they start crawling. So obviously they are going to corners of the room, corners of the walls, touching the dust, and the same hands they are putting in their mouth. So obviously that will lead to a lot of infection. Now, the other way is, say for example, these are the kids who are living with a lot of large families, adults who are going to work, and if somebody catches a cold or a cough, the adults, and the small children come in contact with such adults, the infected adults, the chances that children with their low immune system will be affected more severely in comparison to, say for example, older children. Some children who are 15 years old, the chances of them getting severely infected by contact with an elder who is infected is lesser in comparison to a child who is very small. Obviously, the younger the child, the lower the immune system's response, and therefore higher the intensity of disease in the very young. So I would say, all in all, in so many instances, we hear people saying teething is there, therefore there is increased loose motions, increased cold coughs. No, it's not the teeth. It's the time that at the time of teething, children want to bite, they want to chew, they want to rub their gums against one another. And what will they put in their mouth? They'll put their hands, their toys, whatever comes in contact with them, which may be unsterile, and that causes an increase in infection. So to summarize, it is like children who are bottle fed, children who have been exposed to elders with illness, children who are little bit older crawling and then putting unclean hands in their mouth, and again school going children also, like 3 to 4 year olds going to school. So one child in the classroom is having a cold or a cough, no mask being used, and obviously that transmission of infection is happening through the air. So these are the very common reasons how small children as that between 6 months to 5 years acquire infection. Now, how do we prevent infections in this very young? As I told you earlier on, breast milk is an extremely potent anti-infective, not just nutrition, but also an anti-infective medication. So every child who is born should be given breast milk for as long as possible. At least till 6 months, we aim to give exclusive breast milk so that the child gets adequate nutrition. The chances of infection are reduced because obviously the anti-infective properties, and at the same time you are cutting down the contamination. The chances of infection through contamination of bottles, heat, water used for the milk, it is all reduced. Second important thing is a large number of these diseases are vaccine preventable. So definitive, proper, appropriate, timely vaccination of all children who are born from birth onwards, at least until they are 5 years old, is extremely important. A large number of these diseases can be prevented, and even if they are not completely prevented, the intensity can be grossly reduced by giving them timely and complete vaccination as per the schedule. Now there will be a lot of discrepancy about the vaccines. Some say, well, these are the 6 vaccines given at my place, these are the 10 vaccines given. There's a lot of recommended vaccines from Indian Academy of Pediatrics, and if somebody can afford and they are not included in the government's program also, it is advisable to give them those vaccines as well, therefore preventing those children from acquiring those vaccine preventable diseases. Thirdly, if in case a child is starting to put his hands in his mouth, and this will happen from as early as 3rd to 4th month of life onwards itself, at that point it is imperative or compulsory to start washing the children's hands with soap and water. A lot of time people tell us we are cleaning the hands with wet tissues or with a handkerchief. That will not work. Sanitizers are not recommended at that age. So it has to be with soap and water 3 to 4 times in a day. And this cycle should continue until they grow up and they learn that before eating they have to wash their hands and then start the eating process. So that is an extremely important component. Now, apart from the hands itself, if in case the toys are there, the washable toys should be washed very frequently, dried and then given to the child. Even the unwashable should be sun dried at least, and then given to the child. Therefore, the chances of infection from those fomites will be reduced. Now, when it comes to exposure to sick elders, it's very imperative and important to educate all elders, like whether it is the parents, grandparents, uncles, aunties, elder siblings, that once they are sick, they are not allowed to go near to the child who is very young. And they should use a mask. The elders, it's very difficult for a small child to put on a mask. The elders should use a mask if it is definitely compulsory for them to come closer to this particular child. For example, the mother is there. She's going to the office and then she acquires a cold or a cough. She's breastfeeding her 5-month-old baby. It is impossible for her to avoid breastfeeding the baby. She can put on mask, wash her own hands, sanitize them properly, and then handle the child. And once the process of feeding is completed, after birthing, leave the child to lie down in his cot, and then the mother can come away from the child and obviously take out the mask. So that has to be an ongoing process. It can't be a one-off. For as long as that particular parent is unwell, she should follow that routine. This is just an example that I am giving, and the same should be applicable for all in the family. There's a large number of adulthood vaccines as well, which I strongly recommend, although it is not so much talked about or taught to our people, our population in India. In India, we all think the vaccines are for children only, but obviously COVID has taught us that vaccines are for adults as well. Similarly, there are a large number of other vaccines which adults should take, for example, the flu vaccine, the pneumococcal vaccine, the MMR vaccine. According to their age group, they should be taking those vaccines. Therefore, their chances of transmitting their infection to the younger ones is reduced. So that comes one factor which will help the adults to be able to do to reduce the infection in the younger ones. For that family to understand, the child took the doctor for treatment. At the same time, isolate him. When I say isolate, don't keep him in one room by himself, but keep him at home. Therefore, you have done social isolation. You have not allowed that child to come in contact with many other children of that particular child's age group, thereby preventing the transfer of infection to the large number of peers that he or she would have otherwise infected. So definitely keep them home, get them early treatment, get them good hydration, and therefore the transfer of infection at school will be reduced. Now, apart from all of these, healthy nutrition is extremely important. There is a large number of fruits and vegetables which will be very rich in vitamins and minerals. Every parent who comes to us tells us he is not eating. So the way we can make them eat is, when the child is hungry, we give them a new food and then give it every day for that child to learn how to eat and enjoy that food. For example, a lot of times people tell this child is not eating the vegetable we are giving, then therefore we are giving milk. That will not help this child. This is a 2-year-old, for example, and they are just feeding him just milk. He will have multiple deficiencies. Their milk is not a good source for a large number of vitamins and minerals. All those deficiencies will crop up. They will reduce the immunity and make the child more prone for infection. So a mix of fruits, vegetables, milk, and all the cereals, whether it is rice, wheat, whatever, will be very important in giving a balanced nutrition which will enhance the child's immune system as well. So the focus should be on healthy nutrition, good amount of physical exercise and activity. So every child now, once they cross the age of 2, 2.5, 3, they should be enrolled into some sort of a sports activity, whether it is in the company of parents or otherwise. It depends on the child's interest. Should healthy exercise, good nutrition, hygiene and other things which I mentioned will prevent infection and enhance the growth and development. Kindly subscribe to our channel, Medical Information Clear, If you're in the vicinity in Hyderabad, we are based at Bashirbagh and Banjara Hills at Southern Gem Hospitals. So if you're in the vicinity, you are welcome to come down and let us help your child in resolving the issues that he is facing. And if there are any other people who would wish to discuss or have some queries or doubts, I request them to put it in comment section on the YouTube channel, and we will be very happy to answer and help those children as well. Thank you.